All, this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. So yes, Algebra Bean has been first in both the talks today, and I'm happy that France is back. I hope Doug is doing okay. Margaret, I had called her. I almost call her daily. I keep her up to date with the topics. So I called her today as well. She's doing fine. Michelle says I made the top 5. Okay, so Algebra is here. Denise is here. Denise, I hope that you're doing well. Christine says, got the notification. Excellent. So Alive in Heal says, Eid Mubarak. Thank you very much. Eid Mubarak to you as well. So Eid continues till 2.5 days, this Eid. So today is the second day. Tomorrow is the half day. Tomorrow my wife is flying out, so I'm going to take an off tomorrow, if you are okay with that. And then we will continue from day after in the same structure as before. So slightly bumpy this week that I had an off yesterday. I'll take an off tomorrow. Adam Mar says, thank you for all the research. You're very welcome. So Z, thank you very much. He has gone to New York. They had a team meeting, so he had to go. I think their office with the pandemic had been working in remote setting, and now they are opening up again. So tomorrow they had tomorrow they have a meeting, in-person meeting. So he's back there. So he had a 16 hours. From here he went to Seattle. From Seattle he went to New York. But he's there. He called me this morning to say I'm there. I feel bad because he was supposed to be here till the end of this week, and I had lots of plans. So I've requested him to come back when he becomes free. We are 4 brothers. We do not have a sister. This brother, Yamin, and I are very close. The oldest and the youngest are less close to us, but we two are very close. Is Jana here? Jana is here too. Wow, Jana, welcome. Celebrations. We have France and Jana. Jana, I hope you're doing well. Alive in Heal says, how has been by? He's doing very good. So he lives in Canada, and when he's working here, then here, so he gets less desi food. So when he was here, we fed him a lot of desi food. So he was very happy with that. Good to know, Jana. Yes, all the beans are here. Susan is here as well. I wish Doug was here too, and Margaret was here. I know that Doug Gross, Doug Boss is here. Hey, Doug. Is Doug Gross here? No. Colin Hemmel says, hey, Doc, would be lost without you, and me without you. So I think this has been a journey together, and it has been a great journey. Humble Bean says, I'm here for a few more minutes. Welcome. Joy Fisher says, which brother was biggest troublemaker? Okay, so depends how do you define troublemaker. The most naughty was the one who was visiting, Yamin. He was very naughty. The most, if I'm going to say these things, then my brothers are going to complain. So my oldest brother has been headstrong. He's a very popular medical teacher as well. Actually, much more popular than I am on YouTube. So he used to be very, steadfast. And then Yamin was the most naughty one. Jana, you're correct, but I think we'll be. Denise, you know that I'm being diplomatic because he might watch this. Actually, it turned out there are some cool beans here who watch this, who are uh, family members. So my brother's friends and their family members, some sons, they watch this. So everything I'm saying here is going to eventually reach there. Alive in Heel says, who was the cheeky one? Uh, Elaborate a little more. You know that I'm protecting myself with this whole thing. So Carol says, is there any data about the efficacy of ivermectin against the Delta variant? So there is no efficacy drop. Uh, Ivermectin doesn't care much for the spike protein changes. Yes, it binds to spike protein, but it does have effect on the RDRP, and it has effect on the 3-chymotrypsin like protease enzyme of the virus. It also has effect on importin alpha and beta. It also has effect on nuclear factor kappa B, and there are more functions. So just the spike protein minor changes do not affect ivermectin. Curia says, I have 5 brothers and 5 sisters. Very good. May you all stay happy and healthy. We are 4 brothers, no sister. Our mother used to say that, hey, if you guys had a sister, you would not be so naughty. So you will be a little more civilized. So, so she thought we were less civilized. Colin says, how long before surgery should you quit the drink? I'm a bit on edge for tomorrow. It depends. I mean, mostly before surgery, they tell you since when should you not drink or eat, because during the surgery, one can vomit those things out, and these things can go in the lungs and cause issues. So they must have given you a written advice. I saw a question here. Adeline Sings says, question, should a 13-year-old girl get their vaccine? So I have had these discussions before as well. Cool Beans, who've been here for some time, they know I'm very careful for mother and child advices, because it is difficult for me to discuss those. I'm not a specialist in those areas. Having said that, the children's risk is very less, negligible compared to adults. Because of that, I think it is important to look at the risk first and then see if you are comfortable. If a child, most of the children, if they do not have comorbidities, I did this study a few days ago from UK. If children don't have comorbidities, normally then they do not have severe COVID and they can manage it fine. So just look at that and talk with your doctor as well. So Iggy Pop says, thoughts on new theory that SARS-CoV-2 was created with gain of function in an inflammothrombotic response with mRNA reverse transcription into the cell DNA with prion type formation in the spike. So here's the deal. There is a part of this whole thing which could be true, and then there is a part which is not true. So what happens is, for example, if I take your whole statement, if I take the whole statement, anyone will look at that and say, okay, fine, this statement is not correct. And for example, transcription into the reverse transcription into the DNA is not a proven thing. It's a theoretical thing. Many people say computer simulation shows it and so on. But it's not something that is seen with the actual infection. We have millions and millions of people who got infected. They don't have the SARS-CoV-2 integrated in their DNA. And the reason I'm bringing this up is not to challenge you, but to say that where it is actually in the benefit of the people who would like to hide the gain of function by letting people tag on incorrect functions to say the whole thing this is just a conspiracy theory. Similarly, prion function is also not any small piece of RNA could be a prion. So you could say a small piece of SARS-CoV-2 or other viruses could be prion, but this is not really a mechanism of this virus. So if I remove those extra parts from it to say, forget about messenger reverse transcription, forget about prion formation, just stay with the SARS-CoV-2, let's say, being a bat virus, and from there getting modified to become a human transmissible virus. And for that, they deciding ACE2 activity. And then there is I don't know if they knew, if these scientists were just trying to make sure that this virus can work with ACE2. They may not know it very correctly that what kind of imbalance it would produce, or they may know it if they were being sinister. So the question is, leave all those extra things off and just first address this much. Was there a research to say, let's have the virus be more transmissible to humans? I think that needs to be answered first before other parts. But when we tag on these extra theories, then it becomes easy for these folks to dismiss, including dismissing the truth that might be there. I was looking at Fauci and Rand Paul's discussion, and again, if the questioning was this much, Fauci was saying that there was research on the human transmissibility. So if the questioning would have just stopped there to say, was there funding to have that lab produce animal viruses or modify animal viruses to cause better human transmission? If that was a question, without any gain of function, without any weaponization, nothing, just stop there. And if the answer was yes, then the second question could have been, why was that needed? And then when that was correctly answered, then the third question. So I thought that when he kept adding on gain of function and others, then it was easy for Fauci to simply say, you're talking about gain of function. This is not gain of function. And now the folks get stuck in the definitions and semantics and move away from the basic thing that they were trying to get to. So Adeline says, Doctor, what are you advising for children to take as a prophylactic while at school? So my patients or my family members, I have asked them, again, considering all the side effects and eligibility, I have asked my patients and family members to give 1 weekly dose of ivermectin. So, Jana, you're correct that, let's say Ron Paul was on the correct questioning. But the mixture, that is exactly what I was saying here as well. When we mix multiple mechanisms, then he can say no to one mechanism and imply no to everything. That's why it should have been a little more discreet to say, okay, just this much. Was there funding given for animal viruses to become transmissible easily to humans? Just stop there. And if the answer is yes, then the second question is, why was that done? And then questioning from there. So Blade says, I have hypertension and high cholesterol, also have 20% blockade in my mid-LAD, left descending, with unstable left anterior descending, with unstable plaque. Would Pfizer or AstraZeneca be a better COVID vaccine? So messenger RNA vaccines under 30 are stressful to the heart. We know that much. Above 50, I prefer messenger RNA still more than the adenoviruses. If somebody is a woman, then adenovirus based are generally not very good. And again, someone who is going to review this and say, well, why is Mobeen talking against a vaccine? Europe is trying that women don't get adenovirus based vaccines and they move on to messenger RNA. So I guess it really depends upon the comorbidity, the kind of vaccine. So the best of advice, of course, I cannot give you that advice, is to talk with your doctor as well. The age should be seen, comorbidities should be seen, and then messenger RNA or adenovirus or inactivated virus. So this is a good question. Pazazi says, I heard that long COVID shrinks the size of a man's unit. I'm wondering by how much and if it will ever come back. So it's actually very simple. COVID or long COVID can cause blood vessel disease. If that is happening, then it is possible that the amount of blood, so penile erection and the size, is dictated by the excitement of the man. Sometimes people are not excited that much and their penis may be actually longer or thicker, but that still does not develop to the full size because they're not excited. So there is a psychological part. And then the second part is mechanical, where blood has to come in the penis but not get out. That is the engorgement. So the penis has to become engorged with the blood to develop length and thickness. Now, if the blood vessel is swollen, for example, and it does not allow enough blood to come in, then it is possible that the erection is not long and thick. Similarly, if there is some parasympathetic issues, then that might be a problem as well. Ideally, so far, all long haul issues do become reversed. I think that the endothelial issues with the blood vessels become reversed as well. If that is the case, then this condition should go away. John Y says, I am 34 and healthy, play sports, eat healthy. Should I get vaccine? It's a difficult question for someone like me. Let me do a quick algorithm here. And I've done this algo before as well. And this algo is actually something that I would have wished folks like Fauci's and CDCs of the world should have done it. So let's say we have J&J here. We have Moderna and Pfizer. Moderna. I treat them similarly, although if you look at some European studies, they do find somehow Pfizer to be more with side effects than Moderna. I do not know if that is just bias or that is true. So if that is the case, and you can think of them as separate as well, I'm going to use them together at the moment. Then we have J&J and let's say AstraZeneca, which is J&J's type. So let's say AstraZeneca here. Then there may be inactivated viruses, for which I'm really not sure about the side effects. I'm more up with the side effects of these guys. So now if you see here, I'm going to go with J&J first. We know that adenovirus-based vaccines for women under 50 years of age, they have been causing clotting. So either we find a solution for clotting for them, which we know the solutions, but we make sure that there is a protocol engaged if a woman takes Johnson & Johnson, or they don't get Johnson & Johnson. Instead, they take messenger RNA. In addition to that, we also know that J&J is less effective below the threshold level for people that are 60 plus. So J&J is not really very useful for 60 plus. It is not very useful for women under 50. That means if it is for women, it's really 50 to 60 is the area which is useful. Or if it is for men, then it is under 60 that is useful. That is one way to look at J&J. Then if you look at Moderna like things or Pfizer like thing, there is the under 30. Under 30 is the cardiac problem in men especially. So that means messenger RNA vaccine for men under 30 should not be taken. And then above 30, men and women, it has above 30 men and women of all ages, this has been better than J&J and adenovirus. I do not have a similar chart for inactivated virus vaccines just because one of them is from India, for example, then there are from China. I just don't have this side effect profile for now. So I think ideally this is how CDCs, FDAs should make everyone aware to say, just look at yourself, look at your comorbidities, and then decide from here. Pazazi says, thank you, you're a rock star. Thank you very much. Humble Bean says, regarding the approved vaccines, with the knowledge we now have after a few months, what is the risk-benefit ratio for young adults under 40 years old with no major comorbidities? So I know that I looked at under 18, and it did not look the benefit did not look that great. I was actually planning to sit down and look at the data for under 50 for the risk benefit, and I have not done that analysis. And I don't want to just talk from the from the tweets that people are making. So give me a day or two. I am actually looking at this one, and I would discuss it. So Amanda says, is there an alternative to Maraviroc? I was prescribed this medication, it's 500. So again, other CCR5, for example, leronlimab, I think that would be expensive as well. So not directly that I know of. Is there a question by John? So while looking for John's question, Govind says, is the COVID virus manufactured in China lab or is it natural? So Govind, that is a big question at this time. I have said this many times. I have had that discussion. And I have said that I have not seen this being manufactured. I've not seen this being sent. Folks who raised me, they had said, if you have not heard or seen something with your own eyes, don't say it is 100%. The signs, flags make it feel like that there may be an issue. It may not just be an animal virus by itself that jumped. There may be some manipulation, but I don't have a proof. So saying something without proof is just, at least for me, I always bring a proof to the discussions I do. And it is possible I may be misinterpreting something, misunderstanding something, and then presenting it incorrectly as well. So that is my human part in this all. Edmund says, physically, why are kids safe from COVID? Is there an anatomical reason? So we did this discussion about a year ago. So if you look at my videos, there is a video called Finally Mystery Solved. Why are kids safe? Something like that. But I know there is a words in there, mystery solved. Children have 2-3 advantages over adults. Number one, the ACE2 receptor density in their oropharyngeal areas are lesser than adults. So that means less virus can grab onto their cells, so less viral load. Second is their natural killer cell number and activity is more than adults. And because of that, their innate immune system very quickly responds to the virus and takes care of it, and the viral load stays down even in the initial part. Adults have lesser number of NK cells and they have less active NK cell. That allows the virus to stay active for a longer period of time while the adaptive arm is coming up. And during this time, it damages us more. So NK cells are less in adults. One can do things to improve the NK cells, and I have done that discussion as well. For example, forest bathing, for example, light yoga, for example, staying happy, or at least staying less stressful, because stresses cause stress hormones that cause reduction in NK cell activity and production. Then children also have a cross training of their innate arm or reprogramming of the innate arm by continuous respiratory or more frequent respiratory illnesses compared to adults. Children go to school, they catch respiratory viruses all the time or bacteria all the time. So their innate arm keeps getting reprogrammed and trained to be able to attack respiratory system viruses. And because of that, they can attack better. So there are many things that are going for children. Similar is for their blood vessels and for other tissues as well. Drbeen says, if the antibody response to SARS-CoV-2 is IgG and not IgM, does that mean the virus was not novel to that person? Correct. So if there is no IgM produced, that means that IgM was, considering person is healthy, their immune system is normal, then yes, they were exposed somewhere in the past. That is the time when they produced IgM. Now this is a re-exposure and they will make more IgG. It is possible to make some IgM for some time in this case as well, but usually more IgG because the memory cells make IgG, not IgM. This is a good question though. Curious C says, have you heard anything new on the US possibly making ivermectin used for COVID-19 treatment? I just keep seeing more and more resistance to ivermectin, more and more censorship of the ivermectin, more and more pressure on the things other than vaccines, because I think what is happening is, and this is a conjecture on my end, I think what is happening is that Biden is saying, why am I not seeing a higher number of vaccination? I had said it should be 70% by this. Why is it not done? And he's given the marching order to say, get those numbers done. And everybody is falling in line to say, okay, we're going to focus on vaccine. One way to focus on vaccine is to stop all other discussions. So this is just my hypothesis. I may be totally wrong. But I think if you look at continuous messaging from Surgeon General, if you see continuous censoring of the other messages, to me, it seems like these are to say, get to the vaccine numbers. That means US is not going to make progress on ivermectin anytime soon. I am still grateful that compared to, for example, UK or Canada, US still allows doctors to write ivermectin, and there are organizations like FLCCC that can talk about ivermectin. There are channels like me. Yes, one of my channel is now almost destroyed because it had 4 or 5 videos and they took down 3. But still, there is relatively more freedom compared to UK or Canada. But then there are countries like India and other places which have even more freedom of using ivermectin, although there is resistance there as well. So I'm kind of disappointed at the way US has been doing. But I can actually, again, I don't see this to be a conspiracy theory. I just see that the president gave an order or at least made a desire clear that I wanted this to be this way. And so now the folks are just falling in line to say, okay, we're going to make it happen. And one way for them to make it happen is to suppress other. Somebody had tweeted to me that they're doing a good thing because uh, they said somehow it is good to suppress all these other discussions. And my point of view was it has never been good to suppress all other discussions. And that is how one of the Europe's behavior that made them progress faster was something called disputational dialogue. And that is where people disagree with each other, they dispute about things and still reach to the truth. And so if we just keep stopping others from saying things, then reaching the truth will become a problem. And the only truth left will be, for example, vaccines. And I think that is the problem which uh, media has become a partner. I think media always used to be like this, but nowadays it is more that way. Nowadays, media should not be called media. The CNNs and the Foxes of the world are not media. They have injected news here and there, maybe 10, 15 minutes, half an hour a day. Most of they are opinion systems or propaganda systems for a specific um, school of thought. That's what they are. They have covered themselves as media. And so this is just going on everywhere. I'm not happy with US's behavior. Michelle McDermott says, Dr. Bean, I'm taking ivermectin weekly. Do I have the same protection as a fully vaccinated person? Okay, so I'll give you answer in multiple, from multiple studies point of view. There have been prophylaxis studies that show 74% efficacy of ivermectin in healthcare workers. Vaccines show 94% efficacy, but vaccines also show 40% efficacy depending upon who the person is. For example, J&J for native Indians or for Alaskan residents, J&J's efficacy is lesser, about 40 to 50. Similarly, J&J's efficacy for folks greater than 64 years of age is less as well. So it is really not a blanket statement to say all vaccines are 94% efficacious. It depends upon who these are being given to and what is the vaccine type. So same is the case with ivermectin as well, but there has been studies showing 74%. There are studies that have shown 84% prophylactic efficacy. And then there are doctors who do not have studies, but they say, for my patients, this is what my experience is. And they say, for example, 99%. So I think we don't actually we can't say that ivermectin is as efficacious as a vaccine, or we can't say vaccine is as efficacious as ivermectin. It depends upon the person receiving and the situation as well. France is back. This is the France is being back flag. Attention, Navy beans. The coast is clear. Smash the like and get your Luffy Mectin donut. Yes, absolutely. Okay, so be curious. Carlos Ortiz says, hi, Dr. 32-year-old male waiting for Novavax. So wear N95, not sure if it seals properly, and try to maintain my interaction indoors to less than 5 minutes. Do you think that is relatively safe? It is safe, but for a young man, why not take, let's say, an adenovirus-based vaccine or even a messenger RNA-based vaccine? Be Curious says, are there data regarding timing for onset of symptoms, inflammatory phase regarding the Delta variant versus wild type? Where is the data? Should this affect what constitutes significant contact? Yes. And so so far, what I have heard from the data which I saw, for example, from UK's, is it more contagious or not? They said it is more contagious, let's say 6-fold, but they didn't give a window of time. And what I'm getting from my doctor friends who are working in various countries, The delta's window of time has become 2 to 3 days for the symptoms to appear. That is shorter from 5 or more days for the natural one. But you're correct. Maybe it is my ignorance that I haven't yet seen or looked for such a study. Adam Marr says, any correlation with testosterone therapy causing issues with ACE2 receptors and increased spike protein binding? So, if the therapy for testosterone is to bring somebody's testosterone level or steroid levels towards normal, then no, there will be no issue. It is when the extra amount of these hormones are present, then we have to see if the virus is in the if the patient is in viral stage versus inflammatory stage. In the viral stage, it may be bad. There is one study only that showed that clearances of coronaviruses in the presence of steroids is reduced. That is extra steroid. And then we know that there is beneficial effect in the inflammatory stage. So this is a very good question. Pran Van Arnold says, does increasing the dosage gap between inactivated vaccine also increase immune response, unlike mRNA and vector? Good question. I don't have the answer for this one because I don't know if the Serum Institute India has shown that data or China. I'm not very hopeful from China about it. But that's a good question. Humble Bean says, I'm looking for a way to protect vulnerable patients when they go to the dentist for hours. Any ideas? So, I mean, these are all the precautions that we all should do. In those, of course, wearing a mask, but eventually they're going to need the dentist to work on their mouth. So, wearing a mask is not going to work. Listerine gargles is very important. Then we know about IVM type drugs as prophylaxis. Black seeds and honey is also very important. We know about vitamin C, vitamin D, that is very important. So, a good immune system, a healthy diet, and then IVM plus Listerine gargles are very important. I think that if a person knows that they're going to be at a dentist, for example, I have been to, then Listerine type gargles become even more important because they know exactly when they are becoming exposed, if at all, and they can actually use it right away. And that has shown to be very efficacious. This is a good question. Art Patron Forever says, look at Worldometer for Czechia and know this is not a success story for the vaccine. Let's see. Okay, so bring it here. What is the exact spelling for Czechia? Is that Czech Republic? I know I'm going to misspell it and then I'm not going to be able to, my system is going to hang. So let's see. World trend, if I go to countries. So Worldometer gets hung when I mistype something. Okay, so spelling. Hard patron, tell me the spellings. Okay, so let's see if I can do the alphabet sorting. If I go to countries, so view by country. So it's going to take some time to do this. It happens when I am sharing my screen. So I think it's just some issue with network. So we'll wait for it. And as it comes up, I'll look at it. Eric the dog is here. See, my computer is now stuck there. And even here, the activity is reduced. Okay, so here, if I sort it by country alphabetically, and then if I go here, so Chile and Chad and China, Caribbean, here, this one. Okay, so Czechia, daily new cases are less. How much less? What is this time frame? March. What do we have here? This is July. And no deaths. Am I looking at the correct country, Art Patron? At least on the worldometer, it doesn't show anything significant. So I'll wait for Art Patron. And meanwhile, I'll answer other questions. Rima says, can you help with the vascular question? Yes, where is that question? Roman says, can you get these guests to come on? Dr. Joseph Varun, he, I think, is already set up to be on. Peter McCullough is not. And Nadi Zahda Zolobak, I will have to look him up. Okay, so I know that one of them is on for sure. Where is the vascular question? So meanwhile, I'm going to answer this question as well. Edmund says, is the number of vaccinated people getting reinfected or infected still in line with the expected efficacy? So far, the countries that I have seen, for example, let's say UK, I'm actually observing it very curiously or with curiosity, because if you see here, the number of cases are a lot. However, I don't see the death rate following that. And again, I don't mean that it should follow that. If it does not follow it, it is great. But definitely compared to when it was, UK was at 2000, this is the kind of numbers that were there. Now, these numbers should be attributed to about 28 days before. So if I go back here, these cases, let's say 28 days before June, this is the kind of time that would show these deaths, which are increasing. That means the remaining cases that are here may in another 3-4 weeks show a larger number of deaths. What I do not know yet is the number of deaths in the vaccinated. So I did a talk about that because somebody had sent me a note, but that talk was for a few weeks earlier. In that talk, the death rate in vaccinated was in percentage very low compared to death rate in unvaccinated. Now, what happens now is something to be looked at. So I'll look into this data. So far, it does not look like the vaccines have failed. The cases are more, that is fine. And I have done this discussion many times that it is actually unfair to say that these are although CDC defines it this way. When a vaccinated person becomes infected, they call it a breakthrough. So fine, that is their definition. But this is saying that a vaccinated person should not become infected is not possible. Because, and I know that the scientists come back and they say, well, if the vaccines were sterilizing, then that would happen. And what they mean by that is, imagine a vaccine produces enough IgAs, and those IgAs stay in the mucous membranes all the time, that as soon as the virus lands in the mouth or nose or eyes, the IgA grabs it right away and does not let it infect the cells. And so now it is sterilized. Respiratory viruses and creating sterilizing vaccines, which would create so much IgA and for a long time, is not going to happen. So infection is going to occur. Those who are more vulnerable may even die from that, and as we saw that before, but the percentage is really, really low. Now, would it change? We'll see. But so far, I'm not looking at any such numbers. I'm going to go see if there was a follow-up from Art Patron. Okay, so Rima, where is that question about the okay, so here, Rima says, how will Maraviroc help with vascular immune dysregulation caused by Moderna? Very simple. Good question, though. Let me answer this. So at the end of the day, what's happening is, and this is a hypothesis, that means this is not a proven mechanism. So let's start from the basic knowledge that we have from Dr. Bruce Patterson's work. He says that he has now proven from his studies that monocytes stay in the non-classical state, and as they are patrolling the vascular boundaries, monocytes' function is that they can patrol all boundaries. They can navigate, they can walk across all tissue boundaries. One of those boundaries is the tissue and the blood vessel. There is a boundary between them. So monocyte is sitting there patrolling, going up and going down this blood vessel, and just making sure that nothing is coming out of this blood vessel, or nothing from the tissue is going into the blood vessel. So now what happens is that when the vaccine is given, or when the infection has occurred, the monocyte ends up with S1 subunit in it, and that S1 subunit makes it stay stuck in this state and continue to release cytokines, which causes, so it would, as part of releasing cytokines, let's say RANTES is released. Even if the monocyte itself does not release RANTES, it can cause cytokine release, which would cause other cells, for example, T helper cells, and other cells which we saw, macrophages, dendritic cells, other cells to start producing cytokines as well. Helper cells would start producing RANTES. RANTES would in turn cause more inflammation in this area. And now the boundary of a blood vessel is the area of the inflammation. This would cause the blood vessel to become a little bit more permeable and damaged. That permeability and damage would cause it can cause two things. Number one, when it is permeable more, it would leak and the fluids would ooze out of the blood vessel and into the tissue, causing congestion, which, for example, in the case of brain, that congestion, because brain is a closed space inside a bone, it cannot expand. So when there is more fluid, then the pressure effect will be seen, and that can be brain fog and the confusion and other neurological symptoms. If this is not brain, but other parts of the body, then it is possible that this fluid that is coming out is just causing local tissue congestion. So eventually what is happening is, and if the blood vessel becomes too damaged and becomes narrowed because of the damage and the local area, this whole thing is now a mess. So let's take this out and just make it this way. So let's say now the blood vessels lumen has become narrow because of continuous inflammation around it. Then the blood supply to the tissue wherever the blood is going will reduce. Now to help this, anti-inflammatory Maravirox function is, let's say, to work with the CCR5 or RANTES and block the chemokine function. That means it's going to block new cells to come here. And when the new cells are not coming here, inflammation not only will reduce, but further inflammation would reduce as well. Hopefully that would also allow these cells to die away and just take this whole issue out forever. So that is the basic possible mechanism, considering the S1's presence in monocyte and the remaining inflammatory cycle here. I hope that that helps. So Rima had one more question about VEGF, and it just scrolled up. Rima, your question scrolled up. I'm going to just grab whatever other question. So Art Patron says, worldometer for Slovakia and for Slovenia is same story, no COVID, and the reason is ivermectin. So I think that we can agree on that ivermectin is, even in India, has done its job. Okay, so there was a question here. Nick Gibson says, hi, Dr. Bean. Been a bit since I tuned in. No pun intended. So yes, I was wondering if there was any update on any of the mechanistic explanations of long COVID-esque symptoms after vaccination. So yes, most important thing so far that we know are two. One is this mechanism that I just explained, and if I can remove this, here is a blood vessel, here is a monocyte. This monocyte causes continuous, so it should be an angry monocyte. It causes continuous inflammation in this area, causing tissue congestion and vascular endothelial issues, and even clotting and those things. So that is one mechanism that is now at least seen by Dr. Bruce Patterson, and he has written, and his team has written articles or papers and so on. The other important one that I thought was very interesting was blood cell deformity. So the red blood cells or the monocytes or other cell, they become deformed in their shape. Because of that, there is vascular congestion occurs, because the cells that are trafficking through the blood vessels, their shapes are not correct. They are mushy, they are misshapen, some of them become stiff, and because of that, they cause congestion as well. And that is another possible mechanism. So these are two interesting mechanisms that are here, maybe since you returned, or maybe you already watched those videos. Crystal Owen has a good question. If a vaccinated person gets a current breakthrough, should they quarantine? So very good question. I love this one. So let's say here is a person who was vaccinated and they got the virus. At least for 2-3 days, they are going to be shedding, or at least for 10, 24, even up to 48 hours, so two days, they could be shedding. And if that is the case, quarantining will be useful. I saw somebody sent me a note saying they were quite unhappy with the vaccinated people. They were saying now vaccinated folks will not get symptoms and they would just keep giving us infection. And really, I think we should get out of this vaccinated folks blaming unvaccinated and unvaccinated blaming vaccinated. It is not necessary that when a vaccinated person gets the infection, they would always have it asymptomatically. There is no proof of that, because when they are shedding, if they are shedding, that means their immune system is not able to handle it yet, because the immune system is still sleeping, and it would wake up in 24, 48 hours. During that time, when the tissue damage occurs, they would get symptoms as well. So there is no proof that a vaccinated person would always have non or asymptomatic infection. Similarly, a person who is not vaccinated, when they would get infected, they would shed the virus for a longer period of time, but they would also have a incubation time which would be larger than a vaccinated person's time, which would be asymptomatic time in which they could be shedding as well. So this just blaming each other is counterproductive. We should just look at the mechanism. Both of them can shed. Not vaccinated would shed for a longer time. Vaccinated would shed for a shorter period of time. Now, will they get the symptoms or not? There are people who get the without any vaccine, they get the infection and don't have symptoms. Similarly, vaccinated folks, some will develop symptoms, some will not. Denise says, not if previously infected or on ivermectin prophylaxis. For the quarantine or for shedding? If previously infected, so I'm going to just answer the shedding part. If they are previously infected or vaccinated and got infected again, they will shed for a few days or few hours, 10 hours, 20 hours, because their immune system is still getting up. Now, here is the deal. If, let's say, I got infected, recovered, and now within 2-3 months, my body is actively making IgG and IgA. And within this time period, I become infected again. Then my chances for shedding are going to be low, because my system is still working and I'm still producing IgAs and IgGs. But if I have convalesced, I have recovered, it is beyond 3-4 months, my immune system has gone to sleep or become dormant, and then I become infected again, then it would be 24-48 hours in which person can continue to shed. Ivermectin prophylaxis is also interesting. If a person has ivermectin prophylaxis, in theory, they have ivermectin present and they are going to reduce the load of the immune system. Now, would that be load less enough that they're not shedding? I don't know. That is because we don't have such studies. Ivermectin is still getting recognized at all. I think if we accepted it, that, hey, this could be a useful drug, then we could go to the next steps of understanding it more. But right now, as you can see, people are just dragging their foot on it. Nick Gibson says, will new variants, since they are more fit and have more efficient generation, make vaccinated individuals shed more if they are symptomatically infected, thus facilitating more unvaccinated cases? No. So I know that what you're trying to figure out, that somehow vaccinated would do this. But please realize this as well, that the virus that is more fit, let's say, more contagious as well, that means it would infect and destroy a bigger pile of cells within a shorter window of time. Correct? It would have an asymptomatic or incubation time before as well. But please remember, as it is more fit, fine, it is more contagious as well. That means it is going to create damage rapidly. That means it's not going to stay in the dormant or incubation time for 5 days. That incubation time is going to become 1 day. So if the person is now sick before symptoms for 1 day, how much are they going to shed? For example, for the natural infection, there was a study that showed that the symptoms for the mean would appear on the 5th day. That means 50% of the people would develop symptoms by the fifth day, and the person were shedding 2 days before. Here, let's say the symptoms would appear on the second day because the virus is more fit, more contagious, more virulent. The symptoms are going to appear on the second day. Now, how many days do they have to shed? They have only 2 days. And in this 2 day, the virus has to become replicated. It has to become enough in load that it gets out. So maybe let's say 1 day for shedding and 1 day for incubation. So as you can tell, as the virus becomes more fit, its window will become shrunken as well. So it's not going to shed more. Plant Kingdom says, is it worth waiting for Novavax? Not confident that they will be able to distribute it in the US. So this is my opinion as well, that even if they come back and they say, hey, we have Novavax, I think US is simply going to say, we already have vaccines which people are not receiving. What are we going to do with one more vaccine? So I think that is what's going to happen. Who knows? Maybe the government would say, well, maybe it's a different flavor of a vaccine. Maybe some people will be less hesitant about it, so maybe we should have it. But my thinking is, and I may be wrong, my thinking is government is simply going to reject it and say, we don't need it here. We already are throwing our vaccines away. Why do we need one more? So Kimberly says, so VP shunt due to hydrocephalus and ivermectin. So ivermectin can cross blood-brain barrier if there is an active blood-brain barrier compromise. So it depends what kind of a shunt is it, coming out from the brain, going, let's say, to the cardiovascular system outside, how long it has been there, have the tissues healed around this. So the best way to look at that is to ask your doctor that, do they feel that the blood-brain barrier in some way is compromised? I think their answer will be no. Ivermectin is contraindicated if somebody's blood-brain barrier is compromised, or if they're in active meningitis, or if their blood-brain barrier is being developed like a small child or a fetus in mother. Anjania Ainajana says, please do a series on HIV if like to know why viral load doesn't expand if you tax a system with an mRNA type vaccine. Okay, we can do that. Tika says, I'm waiting for Novavax as well. Yeah, to me, it seems like it may be, given the current situation, it may be not even bought by the US. Adam says, can ivermectin assist with long haul neurosymptoms exacerbated by vaccine? So far, all those patients who have used the long haul protocol on I Recover on FLCCC, that was worked on by me, and then I curated from other doctors as well. So far, I think there is one or two patients out of many, many patients who've been talking with me about their progress, maybe one or two who said, my symptoms have reduced but not gone away. Otherwise, majority of the patients, these neurological symptoms go away as soon as they start with ivermectin. Arbaz Faruqi says, do you think post-COVID brain problems are similar to autoimmune encephalitis? Do you think fluvoxamine and neuroprotective supplements are good enough to or should we start steroids? So if somebody is not responding to fluvoxamine or they cannot take fluvoxamine, then steroids are important. So I believe that for neurological symptoms, giving steroid therapy is important. Barbara says, I prefer to wait for Novavax, so hope they don't send it out. And Barbara, how is Lotus? Someday you should send me a picture of Lotus. I'm gonna show it here. If you have a pet, anyone, send me their picture. I would love to share them. Arbitrary artist says, Mr. Bean, can we chat through an objective cost benefit analysis of vaccines for different age groups? Compare risk. Yes. So over this last few days, when my brother was here and I had taken a day off, I think yesterday, I was thinking about it this way. Somebody asked me on Twitter that how should have been Twitter or someplace. Somebody asked me that what should have been the response for or the way to manage vaccinations. And I had said that there should be, and I've been saying this here for a long time, there should be a chart, there should be a algorithm. That algorithm, actually it was a comment on YouTube. Somebody said to me was that I used to be anti-vaxxer and I have become pro-vaxxer. And they thought I become pro-vaxxer because I become afraid of the government. And my lectures are all on the record here. Very few of them are removed by YouTube. And the ones that are removed are mostly about, I'm not going to name the drug. Others are here. And one can see a year back that I used to say that as soon as the vaccine comes, I would take it. So I have never been an anti-vaxxer who becomes a pro-vaxxer. But I responded to that person and I said, I am of the opinion to have a an algorithm to say who should get which vaccine or who should not get a vaccine. And if the side effects are going to appear, which vaccine should be followed up with what protocol. So for example, it should have been, and there should be one paper by CDC or FDA, somewhere it should be a paper that says age, gender, comorbidities, right? And you say, well, my age is, let's say, 40, male, and no comorbidities. And this, then a chart opens up and that says, in this, here is J&J, here is Moderna, Pfizer, whatever. And in this group, the total side effects seen so far for J&J are these, and for here these, and for here these. And if somebody says, you know what, I am, let's say, 30 or 25, and I am a male, and I have no comorbidities, they should be told that, hey, don't take this, don't take this, take this. So there should be a simple page somewhere that just provides this guidance. And believe me, I feel if this guidance was provided by CDC's, FDA's, with whatever stamp here of Fauci or whatever people, I think this would have instilled more confidence in people than what is happening now. And so people would have said, you know what, they know what they're talking about, and fine, this is my age, this is my gender, this is my comorbidities, and they're saying, hey, don't take this and take this. I would trust them. This was as simple as this was, and they just dropped the ball on it. So having said that, going back to your question, I was thinking of creating this and saying, instead of saying that here is my recommendation, which then gets banned by CDC, instead of that, I would have said, here is a recommendation for CDC to figure out a system like this and then discuss it. So yes, what you're saying is something that should be done. James Walter says, thank you very much for the super chat. Nick says, is there a reason why Novavax is being thought to be more safe than the mRNA vaccine? It is a bit early in the rollout to tell if there is any self-reactivity, right? So you're correct. Look, let me do this pro-cons analysis, kind of an ad hoc analysis. I might not address every single factor, but let's say we have J&J here, we have Pfizer, Moderna, and let's add Novavax to this as well. And my message now for Novavax, considering the muddying of the water around the spike protein, will become a little different. So let me explain. Novavax, what is good for this one? So no cell factories, or cell factories, let's say. Cell factories. That is using fetal cells. J&J, yes. Pfizer, probably. So I should have put AstraZeneca somewhere over here as well. Let's say AstraZeneca here. Okay, I'm going to fit AstraZeneca down here, and let me take your question out. So let's say AstraZeneca. So ideally, this is adenovirus, this is adenovirus, this is messenger RNA, this is messenger RNA, and this is subprotein, correct? I'm not putting in inactivated virus. I do not have the data for them. So cell factories, J&J, yes. So if somebody says, I don't want to have a vaccine with the fetal cell factories, where it is made, or clones of the fetal cells and those factories, then J&J is out for them. Similarly, AstraZeneca is out for them. Pfizer, I think Pfizer and Moderna they use cell factories during design, but they do not use it for their production. Novavax has moth cells. So I think this would be first decision point for someone. Then, second one. Let's say that we talk about, I'm considering all the data that we know now. So then let's say we talk about, will DNA be changed? Again, this, in my opinion, is a rumor. But let's say we're talking about someone and people have these concerns. Will J&J, which is an adenovirus, maybe change the DNA? Well, it does create the DNA that goes into our nucleus. So somebody could say, yeah, it would. I don't believe it will. Will AstraZeneca, another adenovirus, do this? No, I don't think so. But there would be people who would look at this and say, I don't want an adenovirus to bring their DNA into my nucleus. Then with the messenger RNA, people have created similar rumors as well, to say that messenger RNA will become reverse transcribed and then it would become a DNA, and that DNA would go and become integrated and will move on. Today, when we talked about HIV, you saw that HIV has an RNA as well, which becomes a complementary DNA, which becomes integrated in our DNA, but the virus has its own integrase with it. Coronavirus doesn't have, or these vaccines don't have an integrase with them. And so then there are people who are saying, well, we don't need the integrase because somebody should have integrase already present in their cell, and that would be doing it. If that is the case, then everybody who has infection or vaccine should have been out. That is not the case. But anyways, some folks could say, you know what, I don't want this. Same question with the messenger RNA. Some folks could say, I don't want a messenger RNA vaccine because it has an RNA in it, and that makes my cells to produce the spike protein, and I don't want that RNA to enter my cell. I have heard many people saying, I don't want a messenger to tell my cell what to do, although it's not really bad. But so this would be another. Now, if you look at J&J, it doesn't have that problem. No messenger RNA, no adenovirus DNA, nothing. So once again, J&J looks better if somebody has an apprehension about DNA integration. Then spike protein. and cell damage. What does that mean? That means any cell that would present parts of spike protein on it or spike protein on it, that cell can be taken down by the immune system. Now, J&J vaccine, Pfizer, Moderna, AstraZeneca, they would all make spike proteins inside the cell, which will then be exhibited on the surface, or broken pieces will be exhibited. Now that cell becomes a target for the immune system, and will immune system kill it or damage it or hurt it? Yes, 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 yes. Here, in the case of J&J, the spike protein actually is not made inside a cell. Spike protein is already present outside, that is the vaccine. And so it will be taken up only by the immune system cells whose job it is to take up the foreign material and break it up. They will not become destroyed when they're presenting it, because they will present it on MIC2, which is professional antigen presentation behavior. So will the cells get damaged? No. So once again, J&J wins here. Then, now where is the problem occurring? Spike protein itself. Now, folks have made the waters so muddy about is spike protein being itself bad. For example, I was looking at Twitter this morning, and there is a person who is very much adamant that spike proteins are cytotoxic, and he keeps tweeting. And somebody underneath his tweet had mentioned me to say Mubin had said that these spike proteins are locked. And Doug had corrected me that Pfizer is not. Anyways, they referred me there. And then somebody responded to that person and said, well, that wish is gone, or that thought is gone, meaning here is this person saying spike proteins are going to be cytotoxic. So once again, if you look at that now, then all of them, other than inactivated virus vaccine, which also contains spike, all of them are spike proteins, so they are all out. I actually had thought that it was interesting to have the J&J have a spike protein instead of making a spike protein in our cell. And so, but now that taboo, I think, is going to cause J&J to become not liked as well. After this is the age-based efficacy, sex or gender-based efficacy, comorbidities-based efficacy, and so on. That data I just do not have for J&J. So if you look at this, you can see why J&J was actually scoring better points. The problem is, I don't know if the J&J will be given a chance. So I hope that kind of adds some thinking to this. So Rima, you have reached the person who I was talking about. So even this morning, this person had tweeted studies to prove that there is cytotoxicity. And I went and I read all the studies, and they were all BS studies. Colin Hummel says, if steroids are given, does it stop ivermectin from working in any way? No. Or do they just suppress the immune system temporarily? So steroids' function is to suppress the innate arm and the adaptive arm and the inflammation. So they bring everything down. That means if steroids are being given, they're generally, the whole immune system is down. But if ivermectin is also present, the only overlapping part with steroid is nuclear factor kappa B or inflammation modulation. But steroid would have already reduced inflammation so much that that tiny little voice of ivermectin to say, I want to modulate NFK beta would have no effect at all. And then there is no other overlap in their mechanisms. So Nick Gibson, if including natural infection, which will produce much more spike proteins? Of course, natural infection. And this is the funny thing that people have been talking with me. So I had done a video about the number of spike proteins that could be produced after vaccination, in which I had discussed that one cell can have up to 10 million ribosomes. A ribosome can pick up a messenger RNA and transcribe that, or translate that, into a protein in 10 hours to 2-3 days. And so if a cell has 10 million ribosomes and you make them all work on messenger RNA for the virus through a vaccine, let's say, and they're all making spikes, then that's a lot of spikes. So somebody took my message and then did the math on that and came back and said, let's say there are a billion cells here and every cell is producing 10 million spikes every this many hours, and we have so many billions of spikes. Totally agreed. That is the upper limit. Not every cell is going to engage all the 10 million ribosomes to do it. But the point is that when somebody gets infected with the virus will infect a bunch of cells, hundreds and thousands of cells, then come out of those cells in millions of quantities, because the same ribosomes are now going to make viruses, and then enter the next cells which spikes cannot do, and then replicate again into millions, and then come out and enter the next cells. So what spike would do in 2-3 days, what messenger RNA or DNA or the vaccine would do in 2-3 days, virus is going to replicate that way in minutes. But folks do not do that counting. They simply say, oh, so many spike proteins. And I was thinking it may be interesting that somebody left a comment which was interesting for me. They said, Mubin has changed his biases. And I agree that I have my biases. And I have always said that I would disclose my bias as much as I can. So let me explain my biases once more. I have never been an anti-vaccine person. I don't want to say anti-vaxxer to create a derogatory term. So somebody who doesn't like vaccines or doesn't want vaccines. I'm not that. I was not that. I like vaccines. I like the way they protect people. So that is one bias you can say, or leaning, or I'm a pro-vax person. Now the second step. Am I going to pull off what many are saying? I am not anti-vax, but for this vaccine, I am not happy. So even for these vaccines, I feel that now we have enough data as well to start saying which vaccine can be bad to whom and what should we do about that. We also have now sufficient data to say which groups should not get a vaccine, because either vaccine is going to create danger for them. For example, we saw in Netherlands, or vaccine is just going to not help them much, for example, in children. That is second structure of my thinking that I got from the data that we have. Thirdly, I still believe that this concept of long-term side effects of the vaccine is something that is incorrectly used. I understand that we can say long-term side effects nobody has seen, and nobody can now prove or disprove that. It becomes a problem. If I say no, then the question to me will be, how do you know no? That's the same question to someone who says yes, to say, how do you know yes? And they won't have an answer, but this is a good structure that cannot be defeated. But the mechanism of the vaccines is such that we can at least look at that mechanism to say, what will it do? And so far, for example, if I look back here in the same graph that I have here, or chart, let's see which vaccines have a chance And there should be a column here added. That column should say actual use result. Imagine after the use, we actually see that they're not useful. Then all of this game is out. This all discussion is out. Let's say vaccine is not useful. Then why do we compare? So this data will continue to mature for us. But let's go back here for a second. And let's talk about long-term effect. Let's look at the mechanism. Adenovirus-based vaccines. We know that adenovirus-based vaccine platform has been in use for decades now. This is why J&J was able to say that, hey, we have a concern about clotting. They knew that this adenovirus-based vaccines can do this. So one part, the platform is known. And we cannot say this platform is going to cause long-term effects. The side effect of the DNA itself that is making spike proteins, I don't think that there is going to be a long-term side effect that, and let me explain what people say the long-term side effect is. They say that possibly the DNA that is given by the adenovirus is going to get into our nucleus and become integrated with our DNA, and now we will always produce spike proteins. That is just, so we can just prove it by looking at people who have taken these vaccines to see if their cells are producing spike proteins forever. And believe me, if that is what was happening, there are independent researchers who would have already said, this person had Pfizer vaccine or J&J or AstraZeneca 6 months ago, and their all body cells have changed and they are making spike proteins. You don't see those studies because that's not, from a mechanism point of view, that is not possible. What other things spike protein can do? There could be local acute damage. There can be damage here. Or let's say we go with this idea, which I think is incorrect, but let's go with this, that Pfizer study said, that conspiracy study to be hidden study that said spikes are all over the body, in ovary, in liver, in every other place. I still believe that is an incorrect presentation of it. Fortunately, at least I was able to sit down with a person from Japan who helped me, who was in Japan and who helped me translate it. But let's say we take that data. That data said that within 9 days, all of the spikes were gone. If the spikes were everywhere, they said within 9 days, everything was cleared out. So where is the long-term effect there? For the messenger RNA vaccines, the way they're producing long-term effect is the following. They're saying messenger RNA will become complementary DNA by reverse transcriptases, which are enzymes present in our cells. Those will then bring then that DNA would go in our cell, become integrated with our DNA, and now we have DNA forever. That also is a theoretical possibility. We have not seen it. If you saw people having their DNAs changed and they're producing spike proteins in return, you would see them. And there is no locking mechanism other than puberty that starts after, let's say, 9, 10, 11, 12, 13 years. Or menopause that appears near 50. Puberty is a good example of time-based activation of something that our body does. There is no other such example of giving a medicine which would sit in our body for 3 years, and 3 years later, like a time bomb, it would go off and now we have some problem. There is just no such mechanism. So that is not possible with messenger RNA. Inactivated viruses are inactivated viruses anyways. So here is how a long-term side effect can be produced. Imagine I get the vaccine. Vaccine created spike proteins. And let's say my age is 20 years of age. Vaccine produced spike protein. Those spike proteins went and caused damage to my pancreas. And 60% of pancreas beta cells are destroyed. Now, I will not know because the remaining 40% are still able to make enough insulin that I can continue to function. Normally, I develop diabetes when more than 85% of the beta cells are destroyed. So now another person of my age will get the diabetes, let's say at 50, 60, or 70 years, when their beta cells over time would have been destroyed enough in that age, from 20 to that age. And now if I am 20 years, I got infected, I have my pancreas beta cells 60% destroyed, I am left with 40%. Those 40%, when they get destroyed as I age, I will develop, let's say, diabetes at my 40 years of age instead of 70 or 60. That is a long-term effect. I don't think that we have seen that effect with the vaccines, or we have seen that kind of damage to pancreas. But these are the kind of things that should have been looked at. Instead of DNA integrating in the nucleus, and now we are shedding spikes and we are making spikes forever. The discussion should have been, is there a pancreatic damage? Is there GIT damage? Is there liver damage? Is there renal damage? Or we did that for ovaries, that ovas will be destroyed. That is where a discussion could occur, to say, can there be a long-term effect? Will suprarenals get destroyed? Will testes get destroyed? And let's say half of the testes are gone. Will the remaining half go away soon? I think that is a discussion that has not happened. From a mechanism point of view, I don't see that to be a possibility. Another possibility is, let's say, vaccine caused endothelial damage, blood vessel damage, that causes tissue damage that can become a permanent damage. But again, are we seeing that? And there are about 4 billion doses given. I don't think that that is the mechanism we are seeing. So anyways, a long answer for the question that there is just a lot of rumors, and I don't think these are yet, at least in the data so far, that those don't seem to be correct. Okay, we are at 8:18. I like this. Kimberly says, I feel like grasshopper learning from the master. Thank you. France, I hope I did not disappoint you, that you would go away again. Wesley was saying night to Denise. Okay. All right. So how about we stop for now? Is it okay if I take tomorrow off, just one more day, for the third day of the Eid? And then I'll be back on the day after. So with this, thank you very much for your questions, for your time, for being with me, for listening to my conjectures and hypotheses, and not for me not trying to be part of any conspiracy, although it is actually easier to become part of conspiracies. So with this, thank you very much. Please like, subscribe, and share. And if you would like to support this work, there are 3 links in the description. One is to buy me a coffee if you don't want to use a PayPal. If you want to use a PayPal, you have a PayPal link as well. And then there is a link to be a patron as well. So thank you very much, and I'll see you day after tomorrow.